Hello and welcome to the Health for Mzansi podcast. Weekly, we celebrate our health heroes, individuals making a profound impact in healthcare in South Africa. I'm your host, Dawn Noemdoe, and today we have an incredibly moving story about Elizma Appollis, a dedicated nurse and midwife whose passion for caring for others has shaped her life's work. From her early dreams of becoming a paediatrician to her current role in primary healthcare, Elizma's journey is a testament of resilience, compassion, and unwavering commitment. Elizma, thank you so much for joining me on the Health for Mzansi podcast. It is such a pleasure to be able to share your story, get to know you a little bit better, and more about your work within the healthcare field. How are you? Welcome to the podcast.
I'm well, just a little bit cold because it's very cold in Wellington at the moment. I'm blessed to be here today and thank you for the opportunity.
I love doing these podcasts and getting to know all our health heroes in Mzansi. And I'd like to, usually start with your growing up years. You live in Wellington, but you actually grew up in Paarl. Maybe you can tell us a little bit more about your family, childhood memories, any parts that you'd like to share that really stands out for you when you grew up.
I am one of 3 children. I'm the only daughter, my brother older than me, and then I've got a brother younger than me. I was born in Paarl Hospital, as my mother told me, on a Sunday afternoon. And we stayed in Paarl up until I was about 10 years old. Then we moved to Wellington, where I grew up for the rest of my life. Met my husband, got children, 3 of them, and I've been married almost this year for 13 years. But some of my childhood memories will definitely be playing outside with my cousins. Like in Afrikaans, you call it hockey, where you draw in the sand a place where you play, and that's what I did with my cousins, playing tennetjie, as we said in Afrikaans, where you put out the stick and everything, jumping rope with my cousins. And because we come from a musical family, we had so much fun singing until late at night under the lights in the street, and it was very nice. Up until a trick, I think I did all this stuff with my cousins, and it was very nice. That is one of the things I can highlight. We were kids until there was time for us no longer to be kids because we were going in a different role. Going to school for me was a little bit more challenging because I come from a family where my mother and my father was separated. Circumstances beyond my control led me to go to 7 different schools while I was doing my school year. So I was the new kid in a lot of schools at a lot of times in my life. But all in all, I think I was blessed with the best childhood.
It sounds really blessed. People always reference playing and childhood games was very significant at that time, which is so different from now. But just listening to you and hearing the joy in your voice, it really is amazing to listen to that and to share in those memories with you. Now, you did say that you moved from school to school and that was a bit of a challenge for you. Maybe you can tell us what inspired you then to kind of pursue nursing and to become a midwife. Maybe you can talk to us what you were thinking in terms of joining the healthcare sector. Did this happen when you were in matric? You were like, okay, I think nursing is something that I'd like to do. What were the options to you available to you at that point?
It was a little bit difficult because of how I grew up and the different challenges I faced. I think at about grade 9, my dream was to become a pediatrician. I just developed this type of, I want to care for people. If someone got hurt, I was nosy to find out what happened here. If I can just do something to help that one. And I think that kind of triggered something in me. And one day my mother came home and she got this newspaper with an advertisement about Mediclinic offering nursing as a learning place for Mediclinic itself. So I started my training at Mediclinic Learning Center in Bellville. That was the 1st of August, 2008. The hospital where I did my practicals was at Mediclinic Louis Leipold in Belleville, Fort Ricker Road. And that is where I actually grew as a nurse. I always just wanted to go and see if I was interested in everything and anything that I could do to help someone. While I was working there in 2015, I moved to Mediclinic Paul, and that is where I got the opportunity to go and do my midwifery. And that was a journey. I never knew that bringing life into this world would bring so much joy and that feeling of being satisfied in what you do. And just that overall proud feeling. And once I stepped foot into midwifery, which I also did through the University of Stellenbosch, it just triggered a whole new level of interest for me.
It does sound like you kind of found your passion quite early on. You knew that this is an avenue that you wanted to pursue. And then your mom came with the article and things almost aligned for you perfectly when it comes to your career and the passion that you have for the work that you're doing. Now, you say that you've pursued, additional qualifications within, although you started at Mediclinic. What motivated you? At the moment, you're also doing primary care nursing at the University of Stellenbosch. How has this experience been so far? I mean, you have so much experience already, but you keep pushing and you keep growing and you keep developing in your expertise. Tell us more about how this journey has been for you.
My journey started in the primary care started when I was the first nurse appointed in the COVID pandemic in 2020 in the Drakenstein sub-district. And there I had to do site visits on the quarantine and isolation facilities, which at that time was Middle Class Guest House, and then Bindon, which was in Simondium, the recreational center there, where patients that tested positive. So being something very new, I wasn't afraid to accept the challenge and just go head on into this new disease, whatever it was, because I knew somewhere in my life I will come head to head with COVID. So that's where I started, and I was still on maternity leave. My baby was born just a month before we went into national lockdown. So while I was on maternity leave, I got a phone call and the doors just opened from there on. In January 2021, I started my journey officially permanent in primary healthcare at Dalville Clinic, and that is where I did the Well Baby Clinic. And this is where my love for primary actually started just to deepen and develop more. I just thought, no, this is what I want to do. This is where I belong. Today, I am a primary care nursing specialist student at Stellenbosch. I'm still in developing phase, so I'm developing every day, learning something new every day, but I'm really excited for this new journey.
That's amazing, Elizma. I'm so happy with you in it. Honestly, it really is amazing. Just to go back, so it was COVID-19. You had a new baby yourself. You were asked to do very demanding work. That must have been challenging to step away from your own family to care for others. I remember this time. It was a scary time for everyone around the world, and you were asked to do this. How did you get through it? Caregivers and people in the sector, you give so much of yourself. Tell us a little bit more about that.
At that stage, it was, as you said, it was very scary. I think the most scariest part was the fact that it was just an unknown field where you didn't know what to expect. You didn't know what this thing is that you are dealing with. So like every day when I got home, it was like a routine. The bags was waiting for me outside, uniform in the bags before I entered the home. My mother was waiting for the gown on this side, the sanitizer on that side, and then it would be straight to the bathroom to take a shower and all that stuff just to prevent my family from actually contracting COVID. Up until today, in that year, I can remember, I think I lost 4 family members, which include friends as well. So 4 friends and family members together. I lost during the COVID pandemic, and there wasn't a period where you can grieve and then it was another one that passed away. So you had to go to the funeral, get back to work. It was a very emotionally drained period of time, but I would say I learned a lot. It made me stronger and I think more compassionate for everything that everyone is going through. And I think I had compassion from the beginning, but this COVID pandemic just brought in a little bit more depth towards the compassion for my career and the individuals.
Definitely, it sounds like that. And then, outside of COVID-19 and just talking generally now about primary healthcare, in your practical experiences at clinics, what has really shaped your understanding in terms of primary healthcare? And if you can share some of the more memorable moments or the challenges that you faced outside of this very specific period that you just mentioned.
So at primary level, which is the level 1 care of any patient or any individual, now this is where prevention, stabilizing of a new or current chronic illness plays a crucial role. That is now in the future care of the individual or the current care that the one is getting. Some memorable moments would be definitely, I had this young, I think he was about 19 or 20 years old, and he came in the clinic with his mother and he was bleeding up until the point where he was not able to sit up. He had an injury to his hand, which the stitches went open, so he was just bleeding and he was in a state of panic. So for you to intervene with someone and to try and to connect with someone in that stage where they are in are often very, very difficult. So you as the healthcare provider has to get that ground where they are comfortable with you, they trust you, and they just hear the calmness in your voice, and that makes them come to that point where they breathe easily and come from a point of anxiety. I ended up stabilizing him, transferring him to the hospital, and then eventually checking up on him the next morning, because in primary care, after 4 o'clock the afternoon, when the patient is transferred to the hospital, now the level of care has been upped. So it's either level 2 or level 3. But I am one who can never just let someone go, especially when I know that one was very ill or there was an emergency surrounding that one. So I phoned the next morning, spoke to the doctor, and the doctor first said, but he's a little bit difficult because he's lost faith in the health system, because it feels to him that they created the problem and all that stuff. But after that, when I spoke to him and he came back to the clinic, and you could see the glow and the excitement in this young man. And he just said, "Sister, thank you so much for just being there, for just talking to me and not at me, for just listening. Even when I panicked, you were the one who was just there." And that for me is something that stands out, because I know I did my best to help him and it paid off. So challenges definitely would be in the primary care system, would definitely be the amount of individuals to the ratio of the staff members. Because you often sit with a clinic not less than 100 and something patients, and you only have 3 or 4 staff members that's actively busy having to treat all of those patients, who's often not just a stable patient, but someone you have to stabilize, someone you have to spend an hour or more to render care. I think that would be the most challenging part of primary care at the moment.
One thing that stood out about what you just shared, Elizma, is the patient saying, not speaking at you, but with you. That's really something. I got goosebumps when you said that. Your experience, I think I've heard other healthcare professionals talking about the same kind of challenge in terms of staff capacity compared to the amount of care, all of the resources that are also sometimes needed to be able to do the work that you're doing. So that is definitely something that is shared by your colleagues in the sector as well. So very much acknowledged and thankful that you still push through and do what you need to do day to day despite these challenges, honestly. I wanted to talk about the key differences that you've noticed, from working in the Mediclinic maternity ward and the clinics where you do your practicals. And I understand that the level of care should be the same throughout, but is there a difference?
Yes, there is definitely a difference. Because why? In the private sector, the care is the same. So I can't say that the care is so much different from primary care, but the care levels is different. The facilities that you work in is definitely different because you work in a hospital environment. So I would say that in the hospital, you are more following doctors. So you are following doctors' orders. So there's a lot of times where your role as a nurse, you have to listen to what the doctor prescribed for the patient. Where in primary care, you are that one that needs to diagnose, that needs to form a plan of care, a plan of treatment for this patient. So the roles are definitely different from hospital sector up until primary care level, because I think the responsibility is just a little bit or much bigger outside of the hospital. In hospital, I think you are more protected inside the hospital because you are working with the multidisciplinary team. Here in primary care, you also work with the doctors, but that is just after you've gathered your information. That is after you've made the diagnosis. You can now discuss what you found, and the doctor would just say, yes, I agree with you. This is how we're going to treat the patient. So yes, it is different. Private is definitely not something everyone or somewhere everyone can work. But I think that was the best foundation I could ever have started. It taught me everything I know. I think it was the foundation of who I am today.
Thank you for that explainer. As you were talking through it, I made sense of it and I could understand it a lot better in terms of your experience and also obviously the work that you've been doing throughout your career in the healthcare sector. Thanks so much for that, Elizma. Now, you are studying, you are working part-time, you're a mom of 3, you're a wife, you sing, and I'll get to that later as we continue the discussion. How do you balance it all? It seems like a lot. Tell us how you do it.
It gets overwhelming sometimes, but I think I just take it one step at a time. Sometimes if everything gets too much, I just take a step back, I breathe, and I just try to do everything from the start, from the get-go, and just start bit by bit, piece by piece, and I get everything done.
One of your colleagues that I interviewed, Mariska, basically saying your tank needs to be filled up. Don't pour from an empty tank.
Yes. Yeah.
So, and she said it's so like, she was like, you need to make sure your tank is full. Fill up your tank.
Definitely. There's times where you just need to vent. I think there comes times where you just need to vent. But after that, you're okay again. And you just take on whatever you have to take on. You can't climb a mountain by just getting to the top. You have to go step by step. And then you get a prize of the beautiful view from the top. So I think that's how life is.
You spoke a little bit about your work as a midwife, and I wanted to ask you, what are the most rewarding aspects of being a midwife, and how do you support expectant mothers during this journey?
The most rewarding moments is definitely sharing in that moment of first love. Often you find the father and the mother being in tears, and just that relief of thank God it's over, and you yourself, you have that feeling of, this was now a great success. Just to hear that baby cry, and I think that moment is something I can't even explain really in words. For that mother, even if it's a second or third baby, the moment is the same. The way she and the father looks at the baby, just that thankfulness is just something that they feel and you as the midwife experience, and it's something that you don't find every day somewhere. To support the patient, you have to talk to your patient, communicate effectively with your patients, help them understand what they are going to experience. This is the next step. This is what's going to happen. Then when they get to that stage where they experience all this stuff, they like, yes, sister, you did tell me this. And I think that's just something that you have to do, and it prepares them mentally and emotionally on what to expect. And I think that is your foundation of support to a expectant mother or a mother that is in labor. Sometimes they have so much pain that they don't listen, but then you had the chance before that to prepare them. I've often seen that it is very helpful for them to be informed of everything their body's gonna go through, what to expect, and that just makes your job much easier as a midwife.
I must say, as a mom myself, I can't tell you exactly what that pain was, but I was probably one of those people that didn't hear anyone around me. I can definitely relate to the blocking everything out, just being so in that pain and discomfort. But what you're saying makes so much sense. The level of care, the level of understanding, because you're a mom yourself, you've been through it. Obviously, the medical aspect of it, understanding that it's important to explain these things to people, because my body is my body, but do I really understand what we'll go through? I don't know. I don't. So that's a really important aspect. Thanks for that, Elizma. Now, we're almost nearing the end of our discussion, and I want to just touch on a few more aspects. So one is just, how do you see the future, and what are some of the critical aspects of primary care nursing and your specialization? How do you think we could be doing better? Growth in the field? Any ideas or things that you're studying currently that you can share?
So critical aspects would be, I think, to increase the preventative care and education from a very young age. We often get the young people and the children at an age where they have been exposed to a lot of things before their time. And I think that comes in where you go to school and there's a health period, even if it's early in the day, even if it's just for 5 minutes, to just educate the young children about, this is what I have to look out for. This is how I prevent certain things in my health. And this, I believe, will help relieve or reduce the burden of disease on all levels of care, stretching from primary to tertiary levels of care. I think it starts there. Start young, and then you can reap the fruits in the future.
I agree, Elizma, and I think these conversations that we have on our Health Heroes podcast, but also just general health awareness and understanding that it's a journey and that you need to take responsibility. I always say to my guests, I love those mirrors at the Department of Health where they say, you're in charge of your health. They're like, you have to look at yourself. You can't just ignore it. And the understanding is key. Thanks so much for that. Now, where do you see yourself growing in your career? I think that you have such a big drive to do more and learn more and grow in your field. But if you can just share after the study period, what you'd like to still accomplish as a healthcare professional.
In the long term, I would love to open my own clinic, which means that mostly focusing on maternal health, women's health, but being open to broaden my horizons. But that is one of my biggest dreams, to be able to open my own women's health clinic, integrating a lot of things, not only just pregnancy and preventative care, but children coming to the clinic, getting advice, being open for them, and hours where our local clinic might not be open yet, or sometimes they close at 4 o'clock. So I would try to be that one that's open between 4 and 6, just for, say, 2 hours, just to accommodate people that's still coming from work and stuff like that. So that's my long-term dream with regards to my profession.
That definitely sounds like an amazing consideration for people's time, and the fact that it is difficult to take care of yourself if you have to go through the state system and the clinic closes and you can't get off work, or there's really difficulty with a lot of these things, and that is a big challenge. So I think it's admirable that this is what you'd like to do, and God willing, it does come through for you, Elizma. As we wrap up, just to kind of talk about, your fellow healthcare practitioners, if you have any message for them, any message to your family, anyone that you'd like to thank for this journey that you've been on. And then also, before you go, you also sing. You said you came from a family that loves to sing. Maybe you can tell us more about what you do in your free time and what you do to relax.
I'm coming from a very musical family, both my mother and my father's side. Singing was what I learned from a very young age. And it just came natural, and I grew up mostly in church. So in my private time or whenever I have spare time, that's what I love to do. In church, I sing on a Sunday. I'm part of a worship team in church on Sunday. And if life gets too much, that's what I do. I sing, and the very song that I sing would give me strength to move on to the next day or motivate me just to get up and just start again. My love for singing is also my motivation just to keep on going. So to my fellow colleagues, whatever crisis you might face, you must never let it change who you are in this profession. Life happens, work becomes very overwhelming and most of the time very challenging, but never forget to just care. Care for your patients and their families. Care about the people you work with, and most important is self-care. Before I can give care to someone else, I need to be cared for. That is the most important message I would like to give to my fellow colleagues, that no matter what you face, never change and care for yourself so that you are healthy to care for others. I really want to thank the Heavenly Father because everything in my life I owe to Him. And then I would just like to thank my mother who started my journey. Her name is Elizabeth Appollis. And then my husband who's always supported me. Even now in the disaster management here in Drakenstein, he's out in the rain serving the community. That's Elizma Appollis. He's the MMC for Public Safety here in Drakenstein. I would just like to thank all my family members just for being there. I could have never done this journey without any one of them. So thank them all for this.
Absolutely amazing, Elizma. I want to put you on the spot. Do you want to sing a little song for us?
You're really putting me on the spot, yeah. And I love you, Lord, for your mercy never failed me. In all my days, I've been held in your hand. From the moment that I wake up until I lay my head, I will sing of the goodness of God. 'Cause all my life you have been faithful. All my life you have been so good. With every breath that I am able, I will sing of the goodness of God.
Thanks so much for sharing your story, Elizma Appollis, professional nurse and midwife. Your story is a powerful reminder of the impact one individual can make through dedication, compassion, and resilience. To all healthcare professionals, Elizma's message is clear. Never let a crisis change who you are. Continue to care for your patients, their families, and your colleagues, but also remember to practice self-care. Until next time, greetings from me, Dawn Noemdoe, our technical producer Megan van der Vent, and the rest of the #Team Health for Mzansi. Stay inspired.